Hi, today I want to talk to you about autism and pain because it's not what you think and it doesn't always look the way you might imagine. So let's get into it. My name is Sarah Jane Critchley. I'm the author of A Different Joy, The Parent's Guide to Living Better with Autism, Dyslexia, ADHD and more. And today we're going to talk about pain and why it is different in autism and how it's different and what you might expect. Sorry, let me just do that so you can see. The first thing I wanted you to think about was how our experience of pain is very, very personal. It's very different from one person to the next, as is everything in autism, obviously. But the way that you experience pain is very contextual. It depends where you are, it depends who you're with, it depends what sort of environment it's in, it depends the context within which that pain happens. I've got this picture here, this really cute little baby. That's not mine. Not that clean in real life, are they? And one of the things I wanted to reflect on was how when I gave birth to my two children, it was painful. Oh yes, it was definitely painful, but it felt like a good pain. I know that sounds weird, but it was a pain for a good, positive reason. And that's very different to having a pain when you've got something that's going wrong in your body. So to me, I had a pain when I've had lots of problems with my teeth. I've had quite profound teeth problems, lots of abscesses, all that sort of thing. And that pain was absolutely excruciating and dreadful and felt much, much worse. It felt like a bad pain, a dirty pain almost to me, which was very different. So it wasn't necessarily less painful, it wasn't necessarily more painful, it was just very, very different experience. So the first point I want to make is that people feel pain differently and you need to know what is normal for you and for the person you love. The second thing is that we need to think about at what stage pain becomes unbearable. And people have different pain thresholds, high pain thresholds and low pain thresholds. So some people can experience a lot of pain before it causes them any problem. Others experience pain really, really quickly and are very, very sensitive to it. And there's a myth warning here, and the myth warning is that historically we used to think that people who are autistic, who maybe were less verbal, had lower pain thresholds and didn't experience pain. Actually, that's not at all what the research is telling us. And there's a very, very profound and very important difference around what you can see and what is actually experienced by the individual. And if you can't tell somebody that you're in pain, often you'll do something else. And I remember being struck at one of the National Autistic Society conferences many years ago where we're looking at the prevalence of self-injurious behaviour, so when people hurt themselves, especially those who are non-verbal, and the number of times that was related to inner ear infections that had not been diagnosed. And so then they would do head banging as a response to that pain because they had no other way of expressing that pain. So it's important to consider that pain might be at the basis of a behaviour that you're seeing. Different situations affect how you feel, and there's some really interesting research we'll come on to in a minute, but that you feel very different if you're having pain somewhere where you're feeling stressed and anxious to somewhere where you're at home and you can just relax. And one of the things that we were taught when we're preparing for childbirth was to make sure we do lots of deep breathing. Breathing helps, slowing things down helps. All of that's really important. And what you see isn't necessarily what's happening inside the person. I just made that point about self-injurious behaviours. You can't tell what's happening inside somebody, so we have to think about that. There are ways to help. Two things make pain worse. Anxiety and depression make pain worse for everybody, whether they're autistic or not. What we know about autistic people is that their levels of anxiety are usually much higher than neurotypical or non-autistic people. So what we would expect from that, therefore, what I would expect to see is if you're feeling anxious, your pain feels worse, your ability to cope with this is worse. And so one of the things that people do is they then avoid situations that are going to actually cause them pain. And that just seems pretty sensible to me, doesn't it to you? Yeah? So I wanted to talk about responses to pain and how those can be different in autistic people. The first thing to think about is that when you look at the research, autistic people have either the same or lower pain threshold. So this idea that people had a higher pain threshold is not borne out by the research. There's some very nice research there by Dwerdin. And the research also suggested that autistic people were more sensitive to the pain that they feel. And that's not surprising. If you look at the prevalence of sensory differences, how lots of autistic people are more sensitive to things, then it's not surprising that pain causes more distress, is it? There's a difference between pain in non-clinical environments. So if you're in a non-clinical environment, autistic people tend to identify as being less in pain than neurotypical people. And that's interesting, isn't it? So how much calmer am I going to be if I'm in my safe environment? I was really struck because my boy at one point had, he'd managed to poke the inside of his thumb there with a pencil and it went septic. And at one point, he'd had it for a couple of days and it was just, his thumb was a bit swollen. I tried to hold his hand on the way up to school and he went, "Ow, that hurts." And looked at it and his thumb was really infected and thought, "Oh, that doesn't look good." So we took him to the doctors afterwards and the doctor took one look at it and said, "That's really septic. I'm giving you antibiotics straight away. If it gets any worse, at any point, you call 999. I went, because he hadn't complained about it being painful at all, and yet it was so infected that it could actually have been life-threatening if we hadn't noticed. And again, you hear stories of people rocking up to A&E because they've got a child who's got a broken limb or a broken finger, and they hadn't realised because they just haven't expressed that. And I think sometimes part of the reason why they haven't expressed that is because they're calmer and in a non-clinical environment. However, there's a flip side to this. And the flip side is that there was a piece of research where they did blood tests and they observed people who were verbal, highly verbal and highly capable, those who had an Asperger type profile, when they were taking blood. And the responses of these individuals, I think there were about 43, 44 of them, was more severe and the effects of that lasted longer for them. So instead of just thinking, "Oh, it's quick prick and it's gone," they actually felt that pain for much longer. And that I think is really interesting and worth bearing in mind. And the next thing is that we just talked about pain having an impact on self-injurious behaviours. So if you have a pain and you can't express what it is that's causing that pain and you don't know how to make it stop, and perhaps people aren't paying attention, you're going to have to do something to take your mind off it. And if you're unable to do self-care processes, you're unable to read a book or turn television on or do the sorts of things that most people would do, you tend to do other sorts of behaviours. There are things that you can do. This is an example of a PECS board, and this one's from Boardmaker. PECS is Picture Exchange Communication System from Pyramid. And one of the things that they do is they use symbols and pictures to explain things. They're much easier to work with. And so this is just a set of pictures about different parts of the body. So if you see somebody who's behaving differently, you might want to communicate to them about which bit hurts. Okay. There are other alternatives to that as well. One of the really useful resources that I come across is from Widget Health. They've got lots of free resources here which you can download that have symbol-based information. They've got things about how to call an ambulance. There's a really good communication passport for how to talk to people in A&E if you don't have many words, or if you're working in another language, or if you're just plain overwhelmed and stressed. Okay, so that's a really good one. They've got lots going to the hospital, going to the doctors, having an eye test, going to the dentist, so it's worth checking that out. It's widgethealth.com. I'll put the address for you down below. They've also got this wonderful little fold-out card, which is called an ICE card, in case of emergency. And it's a communication card. It just folds out like this. And what it has here is a really useful grid, say how severe is my pain. Okay, so this gives you a way of scoring how much in pain you are. We use pain scores a lot in our house. So your person can just point to it. So if they're having, like my daughter has had really severe migraines, I'm an 8 out of 10. That's really, really painful. And they also have lots of bits here to say yes or no to questions. So there are ways of communicating that. You can just point to it instead of having to say yes. And if you're struggling or you've got something going on with your mouth, if you're in dental pain, talking can be an issue. I know that from my own experience. And making sure that the person's understood what is going to happen so that they're prepared. I don't know. Can you repeat that? Often saying it again, slower, is helpful. That's good, helps. that's bad, it doesn't help. Often using these sort of systems can make all the difference. On the flip side, really, really helpfully, some information, name, date of birth, what language they speak in, blood group, and your NHS number. That could be really helpful because they're going to need that if any paramedics come, or you see anybody in a hospital service, they're going to need that information, and emergency contacts because they may not be able to talk about them. Health and information, doctors, existing conditions, any allergies and medication. All the vital stuff that you need is here. And there's also a version of this for paramedics on the widget site for professionals as well, worth looking at. So that's the information I have for you today. I hope that's been helpful. But if you're seeing behaviours that you're worried about, or if somebody's responding in a way they don't normally, always think pain first. Is it a thing, pain first? I'm going to ask you to do me a favour. If you found this at all useful, please share with 3 people you know and love, and go to my brand new website, differentjoy.com, and sign up for the Different Joy newsletter. So all you have to do is go on to differentjoy.com and look at the Different Joy Club. It'll be there. Sign up and I'll be able to send you more films like this and more help and information. Until next time, take care. Lots of love. Bye.